hacks and tricks, right? So that people can also use them. So hemoglobin, a lifeline to your health. So how many of you think that hemoglobin is really important equally for men and women both? As Neha correctly said, yes, I get, heard a lot of things too. Vedika, why are you asking for us, right? Hemoglobin is just for females, right? It is not that important for a male body, right? How many do you agree that no, it is important for both? Or do you also think that is it only important for the females, right? So what is hemoglobin, right? So there are, red blood cells in our body. So red blood cells carry oxygen and takes carbon dioxide. This whole also in red blood cells, we have hemoglobin. Okay, have you seen this structure? People who are from maybe from science background, they will know. So the basic work for hemoglobin is to carry oxygen and to take out carbon dioxide. This is the basic. So I'm sure this work is done in a male and female body equally, right, Neha? This is not that female body needs more, oxygen. So this is the basic example why hemoglobin is important for both male and female, right? Having a good levels. So my body is also carrying the oxygen, right? My body need oxygen. The males who are here, their body also needs, equally oxygen. So this work is done by, hemoglobin. As is written here, protein molecules found in red blood cells, it's responsible for transport oxygen from lungs to rest of the body and carry the carbon dioxide, right? For exhale. So hemoglobin, who all know what is the, how hemoglobin made, what is the mixture. So why we keep saying increase your protein intake, you're right? Because hemoglobin is, made up of a lot of, folic acid, protein, and iron and B complex, right? So that's why we keep saying to increase your protein intake. So basically, hemoglobin is a mixture of protein, B complex, and iron. Right? Neha, would you like to add something here?
Yes. So hemoglobin, we don't need to worry, much. What is hemoglobin? Heme. Heme is something which is called iron, right? Any iron-rich food helps in making this, component. And when iron combined with globulin, globulin kya hota hai? It's a protein. So heme and globulin, these are the iron and the protein when combined together makes the RBC's hemoglobin of the blood. And this is very important because these iron and hemoglobin when mixed together, globulin when mixed together, what it do? It helps you in carrying the nutrients to your different cells. हम जो भी खा रहे, we are eating so many things, but then this should get absorbed and it should be transformed, and transmitted to different body organs. How will it get transmitted? Only if you have good amount of iron and the protein content in the diet. That's why we keep emphasizing more. Please eat the nutritious food. Please focus more on the vegetables and make sure that each meal have the proteins. हमारे बॉडी में everything, even हम hair की बात करें, we talk about the skin, blood, everything is made up of protein. And if we don't eat the proteins in the diet, then the composition of the blood cannot be completed. And there we start getting a lot of infections. The whatever we are eating, the nutrition, and the nutrient rich food, हम सोचते हैं कि अरे हम तो खा रहे हैं, but हमारे बॉडी में तो एब्जॉर्ब ही नहीं हो रहा ना. कैसे एब्जॉर्ब होगा? Because iron अच्छे अमाउंट में है नहीं, protein we are not having. So we need both the ingredients to make sure there is a proper transportation of the oxygen from the lungs to the rest of the body organs. And when this oxygen is getting transported to the different vital organs and the cells, this is also carrying the nutrients along with that. And this nutrient is helping you in flourishing your body and nourishing your body. So this is really important. Secondly, whenever we are eating any food, it is releasing behind the free radicals, carbon dioxide, and now again the blood is going to carry all the carbon dioxide, which is a waste product for our body, and throw it out into the lungs so that lungs can exhale when we breathe out, right? This is the natural process. You can live without breathing? No. So it's very important to maintain your hemoglobin levels, your iron levels. And if your hemoglobin level is good, your body will keep functioning well. Many people come to me, girls especially, they come and say, even men's come nowadays, that my skin is so dull, Neha, I so many good things. You have told me to eat new, seeds, ye sab khane ke liye, lekin there is no. Okay, what is your hemoglobin level? 8, 10, 11. So at this level, how the transportation of the nutrients is going to take place? And when it is not getting transported to different cells, you won't be able to digest your food and absorb your food, right? So over to you, Vedika.
So,
Let's take it
yes,
forward.
Nanya, especially this is the best time. I love this winter season. Reason you'll get a lot of green
Lot of
leafy
greens.
vegetables around
Actually,
this time,
and
right?
recently we did the challenge also to have the colorful vegetables in their chapati,
Yes.
ताकि ज़्यादा से ज़्यादा nutrients जाए. And that's the reason I keep on asking you to please join the challenges. It's for you, it's for your betterment and good health.
And I also want people who are, who are here, I want you to try this, as Neha said, try to include a lot of green and protein in your diet and see your readings. And then try and even your skin, your energy levels. A lot of people come, Vedika, we are having, this fatigue, we are having this tiredness, right? So I hope Neha, you also get the same thing, right? The people these days people complain there's a lot of things and they keep
Yeah,
saying we have increased the diet, we have increased the chapati. But have you increased your fiber intake? Have you increased a lot of green leafy vegetable? Maybe
absolutely.
people keep checking Vedika weight to mera sahi aa raha hai, but I'm fatty still. I'm having a lot of fatigue and tiredness. So you need to take care of these small things very well. As I said, taking why I've included amla in my diet because I want this iron and everything to get absorbed very nicely.
That's
Having protein, not taking proper amount of water is of no use, right? So whenever you're having a good amount of protein, you need even whatever, just make sure you're taking good amount of protein. And whenever you're complaining for fatigue and tiredness, even we suggest to get your, along with your HbA1c, we always say check your hemoglobin levels as well. People who have lesser hemoglobin levels, especially females, they complains after the baby they deliver baby or things like that. That Vedika, our energy levels has gone drastically down, right? So we always suggest to check their hemoglobin levels, once. So yeah, even I struggle with that part, right? So mine was 8 when I delivered my daughter.
okay.
And then when I realized, and this was new for me, right? Though we keep saying to our client, but we never applied this thing to us. And then when I started making these changes, I've seen a lot of difference in my energy levels as well, right? So let's go. As we discussed, right, importance of hemoglobin, as Neha rightly said, oxygen transport, carbon dioxide removal, and respiratory facilitators. So these are the important of hemoglobin in our health, right? Now, understanding HbA1c. So this basic question I wanted to ask, do you know what is the lifespan of a hemoglobin in our body? Because our body keep making hemoglobin, and hemoglobin is made up in bone marrow, basically in our bones. Right, Neha? So basically
Absolutely.
hemoglobin is made up in bone marrow. The life of our, so every 3 months our body make hemoglobin.
That's
So
why we check our HbA1c every 3 months.
yes, yes, right. So inside the bones, as I said, it is made inside the bone. The normal range is 12 to 15. People who are maintaining their, for girls, it is, 12 to 13 these days. As Neha is an, classic example, she has maintained her A1C, HbA1c, sorry, this hemoglobin for 15. Even I'm going to try for that, right? So basically what happens now, the interaction between A1C and your hemoglobin is type of, A1C is a type of glycosylated hemoglobin. So just give me a minute now.
No worries, Vedika. So Vedika has said rightly, that it's very important that we maintain a good levels of hemoglobin in our body so that our body can function properly. And every 3 months, the hemoglobin is getting completely changed. The body prepares its new blood, and that's how the rejuvenation of the blood takes place. Because body has a very beautiful system, a lymphatic system which cleanses itself on its own, and that's the beauty of a human system, and we have to respect it. And if we just take care of our lymphatic system, it's a blood flow is happening smoothly, we are taking care of the iron levels, the protein, automatically your most of the health concerns and the issues will get resolved on its own. I hope, Vedika, you're feeling better.
Yes, because of rain, I had something
I
very cold
know.
yesterday. I'm very prone to
It's
tonsils. That
okay.
is,
You can give it to me whenever you feel like
yeah, no worries.
taking it
So
control. So it's
one thing
okay.
which, the slides, I'll make it very easy for you. How we form A1C, right? So RBC, basically the red blood cells, whatever you have, the excess sugar you're having in your body, the sugar in your body, that combines with your red blood cells, right? And that's make your HbA1c, right? This is the easy, the more sugar level, the more it will bind with your hemoglobin, and the more your A1c will be on the higher side, your HbA1c will be on the higher side, right? So as we said, this is the glucose, this is the hemoglobin, the red blood cells is here, right? And when they add, basically the excess sugar is added, with your hemoglobin, you will see a spike or increase in your A1c. That's why we always check your A1c after every 3 months, right? So whatever, so what is happening, our body, just separate iron from the hemoglobin every third month, and then use it in the other part. And then every 3 months, your hemoglobin will again be formed in your bone marrow. So that's why we say that, check your HbA1c every 3 months. So people, when they start, making a lot of changes in their diet, they say, Vedika, oh, it's been 1 month. Should we go for your HbA1c? We will see a good difference now. So this is the answer why we say no. HbA1c should be checked, or we should always check our HbA1c after every 3 months, right? Yeah, can you help me with this slide?
What happened? It's not moving. Just click on the slide choice. Enter the वाला 2 बार कर दो.
I'm not able to do it.
Not happening?
No, got stuck.
Just stop sharing. I will do it.
Okay. Okay. So now I hope you know when to check your, what is the better range of HbA1c. Can you help me with the, if you're trying for a complete reversal, we always say go somewhere around 5.8 to 5.9, right? That will be the, better range for HbA1c. And go slow. Please do not, try to do it at once. Yeah, I'm not able to see this screen.
You are not able to see the slides. Everyone else able to see the slides? Yes, no? Screen is visible. Are you able to see the PPT?
There's some issue with maybe. No people are able to
Because
see. Can
I
you please
think
share it?
I'm able to see. Is it visible now?
Can you take this one? Let me,
Yeah,
rejoin.
sure. So there is always a link between the HbA1c and diabetes reversal. Q. Anyone has any clue why HbA1c and red blood cells are so important in the diabetes reversal journey? Anyone has any clue? You can write down in the chats. I will like to read it out for everyone. क्या लगता है आपको क्यों रेड ब्लड सेल्स बहुत जरूरी है? अभी तक हमने बहुत सारी बातें डिस्कस करी हैं. क्यों रेड ब्लड सेल्स जरूरी है? एक आयरन लेवल होना जरूरी है, हीमोग्लोबिन लेवल होने जरूरी है, सो दैट वी कैन रिवर्स आवर डायबिटीज. Right? Sometimes the drop in the HbA1c is less. We are doing everything, but the drop in the HbA1c is less. It is all because your red blood cells, your hemoglobin level is not appropriate in the body. If your hemoglobin, 1 second. If your hemoglobin levels are not better in the body, are you trying to share the screen, Vedika?
No, I'm not trying.
Achha, so something went wrong. Okay, so if your hemoglobin levels are not good, what will happen? The diabetes reversal will not happen. Your HbA1c will not drop, or even if it drops, the drop will be very less. So there are many clients of mine. This is also the research which has come up with our learning as being available on the or present on the diabetes reversal platform. बहुत टाइम ऐसा होता था कि post-prandial readings have dropped to 120 after the meals, and the fasting is also 85, but we are not able to see a good drop in the HbA1c levels. And then we started researching more and finding out what is the reason why the drop is less. And then we figured out because of the low hemoglobin level, the blood cells, the glucose levels are not dropping in the body. So it's completely related to each other. One of the major indicator of the reversal and the good blood sugar control is the hemoglobin also. whenever we have the uncontrolled diabetes means आपके glucose levels control में नहीं है, 140 के नीचे नहीं है, तो क्या होता है? Doctor always says that, in the general platform, because they have to maintain through the medicines. They say 180 तक reading से खाने के बाद absolutely okay. But what is happening inside? Whenever you are eating high glycemic food, बहुत ज़्यादा carbohydrate rich, it is increasing the blood sugar levels. Now this blood sugar levels, what it is doing, it is going to your bloodstream. ये हमारे blood vessels हैं, ठीक है? ब्लड में जाके क्या कर रहे हैं? आयरन निकाल रहे हैं और उसकी जगह ग्लूकोज मॉलिक्यूल्स यहाँ पे बढ़ता जा रहा है. That's how your iron levels are dropping. हमारे iron levels क्यों नहीं बढ़ते हैं डायबिटीज में? Why it is not increasing? Because whenever we are eating wrong, whenever our blood sugar levels are not within a good control, what happens? The iron molecules are getting replaced by the glucose molecules. That's why we call it glycated hemoglobin. Okay? And that's the reason your HbA1c is not dropping. Until and unless you utilize these glucose from the blood and replace it again with the fresh iron content to make it a good hemoglobin and the red blood cells, your body won't be able to support you, right? This is the major link between the diabetes reversal and the HbA1c. If your red blood cells are less, your HbA1c will not drop. And how we can understand? With our hemoglobin levels. That's why eat the hemoglobin rich, iron rich food. Make sure you are exercising. How body can produce and replace this glucose molecule? By exercising, not just the walking, strengthening. Do the strength training. That's why I said join the health series with the boot camp in the next week coming on 6th to 11th of February. Every day 7:30. You will learn the exercise that will help in rejuvenating your red blood cells. And when we rejuvenate these red blood cells, the glucose molecules will start getting utilized and moving towards our muscles to help us in cleansing our blood. Right? Detoxification is very important. Proper timely cleansing of the system. हम रोज नहाते हैं ना, we take a bath daily. Same way, internal body cleansing is also very important with the detox. Give the rest to the system. Let the system heal itself. And once you start getting into the rhythm, you understand the basics of cleansing the internal body, which is more important than cleansing the outside body. Will help you in progressing speedily towards the reversal journey. It will make your system more stronger. It will help you in fighting any sort of infection, any sort of complications, and you will be completely diabetes-free, complication-free. So if you want to reduce the risk and the complications of diabetes, which is on your nerves, which is on your kidney, which is on all your vital organs like heart, your liver, it's better to understand your hemoglobin has to be always within a higher range. 15 से कम नहीं चलेगा. Always within 14 to 15. Take good care of your diet. Check your hemoglobin every 2 months and find it out what are the readings. And if it is not absorbing, talk to your coach. Tell that, no, I want my hemoglobin to be above 14. Okay? Below 14, not tolerated. And for men's, always 16 and above. Right? So that's the relation. If you have anemia, means low hemoglobin levels, the diabetes will never go. That means the diabetes is present. The blood sugar control is bad. And we have to bring the good glycemic control. And if you bring the good glycemic control, you will automatically get the good reversal rate. I hope I'm clear. This point is very important. You should understand why the red proteins are so important. These red blood cells are your life. We always say that, heart is red in color, which gives life to us. And these red blood cells are the basic unit of, nutrients which are getting supplied to different vital organs to function appropriately. Now, what happens exactly? Due to the high blood sugar readings, बहुत ज़्यादा body में inflammation होता है. We get lot of heat inside the system. Now, because of this too much of heat, there is an inflammation. क्या होता है when we get lot of, like when the summer comes, it's scorching heat, outside. We feel like, the skin is burning. The same way inside, बाहर का तो हमको पता लगता है. Inside, when there is lot of heat and the inflammation in the body, what will happen? The cells start getting it starts getting proliferated. Proliferated means मरने लगते हैं, die करने लगते हैं. Our good cells are dying. The number of dead cells in the body is increasing, which is the making the body sick from inside. Now, how to flush it off? How to cleanse the system is very important. Make sure you are exercising every day. Breathing practice so that you can flush out all the carbon dioxide from the system. When you exercise, these dead cells get passed through the cleansing organs like kidney, liver, your blood, your skin. These are the cleansing organs which helps in cleansing all these dead cells from the system. घर में सफाई रखते हैं, अंदर की भी सफाई करनी है. We have to cleanse our internal system. So prolonged inflammation always hampers the iron absorption. हमारे blood में इतना heat होगा ना, तो blood जो है ना, it becomes acidic. We always talk about the pH level, alkaline, neutral pH level and the acidic. जितना acidic side में होगा, उतना inflammation बढ़ेगा, उतना ज़्यादा हमारा iron absorption, even B12 absorption, folic acid absorption, जितने भी nutrients हैं, इन सबका absorption हमारा कम हो जाएगा, which will result in anemia. ठीक है? And that's the reason we feel fatigue. Diabetes में, it's not that your portion size is less, that's why we are feeling fatigue. We are feeling fatigue because the nutrients what we are eating is not getting absorbed in the system. And unless the system is able to absorb your nutrients, what you are eating, it will lead to anemia, it will lead to fatigue, it will lead to brain fog. कभी कभी होता है ना, कुछ समझ नहीं आ रहा है कि करना क्या है next. We go completely lost, blank. This is all a sign of a brain fog. You should understand these signs. बहुत heat जो अंदर body में लगना, acidity होना, constipation होना. This shows your system is clogged up. Your system is not working efficiently. And once we start focusing on our system by cleansing it timely, it helps in proper iron absorption. And once the iron absorbs well in the system, your glucose molecule starts going out. It gets utilized by the rest of the vital organs, your muscles, and your HbA1c will drop beautifully down. So अभी हम करेंगे कि नहीं? We have to reduce our HbA1c levels. How many of you are going to take, implement these changes in your diet? And अगर आयरन अच्छा नहीं होगा तो B12 भी अच्छे से नहीं एब्जॉर्ब होता है, इसलिए हमेशा vegetarian people or even non-vegetarian people who eats non-veg, their B12 and iron is always on the lower side because we don't take care of our iron. And the B12 and iron deficiency is very, very common. Even the D3 also doesn't get absorbed well. So keep the system cleansed so that whatever you are eating, we are able to absorb it well. Exercise regularly. The natural immunity booster, the natural way to increase the absorption of the nutrients. So write down in the chat if you are going to focus on your hemoglobin levels from now onwards. It's not just for the women, it's for everyone. And make sure you are exercising 5 days a week and join the health series because that is the series which will give you detailed insight on how to exercise, specifically keeping the diabetic, concerns in the mind and get the best benefit. Thank you so much. I hope the session is clear so far.
Now one.
How are you feeling, Vedika? Is it better?
Yeah, I'm better. I have 2 glasses of lukewarm water. So, this is very important to reverse how you can reverse your diabetes. This is very simple. Trust me, when some client comes and Vedika and we are struggling a lot with our A1C levels, trust me, it's very easy. All you need to do is do a basic lifestyle change. We are not asking you to have a fancy diet. We are simply asking you to have which is very easily available, right? So as I said, Neha correctly said, exercise, diet, and stress management is equally important. We have seen in a lot of cases, people, when they are up, I have seen a lot of questions over here. People, Vedika, जब भी हम सुबह सो के उठते हैं ना, our sugar spikes like anything, even without eating. So do you know why our sugar spikes without eating in the morning? So I will tell you my experience. A lot of my clients are, housemaker, or maybe they have to rush to their office. So it's a lot of thing in our head. I have to get ready to kids. I have to go office. I have to attend this meeting, that meeting. The moment you are up, you start thinking about your, day. So that stress level goes up, and that's how your sugar will also start spiking, before your breakfast. Neha, am I making sense? This is the most
absolutely
right? So especially with women's, I have seen, because they have to get ready to kids, and maybe even for that matter, it's for men also, those helping, equally, that we have a lot of in our head that what to eat for breakfast, what to make for ourselves. So managing stress is equally important. If you're doing exercise and diet and still your readings are not coming down, just think once. I always say make a journal for yourself, right? Write it down on which day your sugar is high. You will see Sundays are slightly better. And that's my experience with my client, right? Sundays, I've
Yeah,
never seen, with the CGM, the sugar is spiking that much because we are more
absolutely.
relaxed on that days, right? So when I say lifestyle change, always make sure you're having a good, plating method. So when I say plating method, it divide your plate into, three parts. 50% it should be with your green leafy vegetables or your salads, right? Now, remaining 25% will be your carb and 25% will be your protein. Is it that difficult? I don't think so. Not for a diabetic patient. Anyone can follow this plate method.
Yeah, Vedika, so we will take these sources later. I think Dr. Jyoti has already joined us.
Okay,
So we will share the sources in some time. But before that, there are a lot of burning questions which users have raised. And I want to take that questions from our, you know, um, healthcare expert, Dr. Jyoti Balgopan. So just one second. Vedika, just check you are able to see Dr. Jyoti. Ma'am, there are three. Oh, yeah, Dr. Jyoti, I can see.
I can see. Yeah.
So Dr. Jyoti went for her performance, and I'm very grateful to her that she joined us. Vedika, can you make her the co-host? Till then, I'll just. Vedika,
I'll
you're
make
on
it.
mute, seems. Yeah,
Yeah.
please make her the
I'll make it.
co-host, Dr. Jyoti. So, so Dr. Jyoti went for her performance, and she joined directly from there, and I'm very happy that she has joined us today. Um, Ma'am,
I've
we are
done it.
not able to hear you. Can you please just unmute yourself? I just want
You
to.
have, I can, yeah, you can hear me now?
Yes, ma'am, I can hear you. So,
Yeah, good one.
good
Yeah,
morning, ma'am. I would like to invite Dr. Jyoti. She's a distinguished alumni of SSB Medical College, Cuttack, with a robust medical background, hosting postgraduate qualifications in geriatric medicine from MS Ramaya and a diabetology fellowship from Mohans. She boasts an impressive 30-year career in diabetes management. Dr. Balgopal extensive experience spans across Kerala, Karnataka, Tamil Nadu, and she's a true polyglot. She's fluent in Malayalam, Tamil, Kannada, Hindi, Odia, Bengali, and English. And I'm like spellbound. How many languages? Just name, and I think she knows all. So, offering a diverse and comprehensive approach to her patients, she's one of the best, finest doctor we have. Thank you so much, ma'am, for joining us in today's session.
thank you. Thank you, everybody.
Yes.
Okay, good morning. So I will just give a brief outlay. After that, I will take the questions which you have taken. So this is from the doctor's point of view. I'm sorry, I'm keeping moving because I've still not reached home. I'm just in the outside the auditorium actually. So basically, we have to see what anemia is. It's basically a reduced ability of blood to carry oxygen due to several reasons, which could be decrease the red blood cells or hemoglobin or any hemoglobin abnormalities like sickle cell, thalassemia, and other things. And it basically presents as weakness, inability to work, headache, tiredness, and palpitations, which is increased heart rate or breathing difficulty also. At the same time, diabetes is basically inability of the pancreas to produce insulin, or because of the insulin which is produced is not being taken up by the tissues, which is insulin resistance, the sensitivity has decreased, or because there is total destruction of the pancreas in certain cases, which may be type 1 or pancreatitis or so on. Now, in certain places, we see anemia and diabetes together, and it's a concerning piece of evidence for us because of two, three reasons, which I will see. Sometimes we are treating patients for diabetes. We see whatever you do, we are increasing the medicines, the HbA1c doesn't decrease. We actually have to look back and check a CBC, and we see that there is low hemoglobin. Now, what happens is HbA1c is glycosylated hemoglobin. It's a type of hemoglobin in which the glucose attached to the hemoglobin, and then we calculate it, and it lasts in the body for a long time. So, and this is a very strong molecule. So, when it attaches to the hemoglobin, then what happens is that the oxygen level is oxygenation decreases because it needs oxygen to stay there. So that is one. So you will always be seeing a higher HbA1c because it's not being coming away from the RBC. Other thing is that because there is the number of RBC is less, the amount of glucose being taken by the RBC for uptake into the other places is less. So the amount of glucose in the sugar in the blood, which we measure as random blood sugar, fasting blood sugar, something will remain same. These are false glucose positive. So what happens? We are going on increasing medications, but actually the patient is not hyperglycemia. He is actually less than normal. So once we treat hemoglobin, then we supplement that, they actually revert, and then we see a lowering of HbA1c. So it gives a false perception that the patient is highly diabetic when he actually is a controlled diabetic. So that is one of the, not only that, it also presents because of B12 deficiency. See, when you see diabetes, most of the people we see a low so vitamin B12. That is because the glucose in itself and the HP and the glycosylated hemoglobin in such also takes up the vitamin B12. And this vitamin B12 deficiency causes anemia actually because it is required for the bone marrow to produce hemoglobin. So that is another thing we have to keep in mind. Next is something like iron deficiency in which the food taken is less or absorption is less because of diabetic gastropathy. So all this has to be in our mind. Next, there is the most important thing is called as diabetic nephropathy. The first indication of a diabetic nephropathy is a falling hemoglobin in a diabetic patient. Hemoglobin doesn't fall unless there is a blood loss or something is happening in the kidney, because kidney is the place where the hemoglobin is produced by erythropoietin. The hemoglobin is not produced because the flow to the bone marrow also reduces. So the RBC is reaching the bone marrow decreases and it doesn't respond. The EPO, which is found in the RBC, doesn't reach there. So the amount of hemoglobin produced decreases. This is mostly in case of nephropathies, and also the anemia in itself also causes destruction of the eyes and the nerves. The simple reason is because the same glycosylated hemoglobin prevents the flow of blood flow as well as prevents the uptake of oxygen because it needs that oxygen, it holds that oxygen. And so destruction of nerves which require glucose and oxygen to perform is not there. So nephropathy, retinopathy is seen more in case of people who have got diabetes. So with the moment we see a low hemoglobin, we should actually focus on treating it actually. Not that, okay, that is one side, we will treat hemoglobin, we will reach a position in which patient is actually hypoglycemic and we are going on giving more medicines. Besides, we actually focus on diet and exercise to improve the glucose levels. Now, a person who is anemic cannot exercise much because he doesn't have the energy or the oxygen saturation to move more. So the exercises amount decreases, and again will be struggling to control it with diet and exercise, which basically what sugar fist does actually. Not only that, we also have to see that certain medicines which we get in certain medicines actually decrease hemoglobin. So we have to be careful in the people who are prone to be anemic to decrease those medicines. Metformin is one actually, even though it's the safest, this is where because it acts on the B12 metabolism, destroys the B12 metabolism and hence causes anemia due to B12. So we usually supplement B12 in people whom we are giving metformin for a long time. Even though it is safest in the other places, this is one place where we have to rethink about using metformin. Not only that, some people who come as diabetes are also having BP and other things in which they are using some BP medicines like AC inhibitors. These are less used nowadays, but some people do use enalapril, risperidone, all the pill parts are actually AC inhibitors. They decrease blood flow because that is what they do to decrease the, and that leads to decrease in hemoglobin actually. Okay. Other one is thiazolidazone, which is also a BP medicine. So these are the three places where we always have to think, see, he is already anemic. We have to think, should we give this or should we have to weigh the risk and benefit. So that is why from a clinician point of view, anemia is very important actually. Now, if you ask me how long, how many times do you check anemia, we actually advise for a yearly test in a normal individual. If he is a diabetic, at least a 6-monthly test, that is twice in a year. If it is very low, like 8 or 9 or something, we actually go for a 3-monthly check so that we push up the hemoglobin a bit. Now, treatment will be basically correcting whatever is there, the hemoglobin by vitamin B12, by giving vitamin B12, checking the ferritin and iron concentration, supplementing that, then decreasing the medicines which cause the At the same time, also, if it is lesser than 8, we actually consider blood transfusions, packed blood cells, not just blood transfusion, because the patient will not actually be able to manage the whole blood because the volume is low, he will overload. So it has to be a packed cell. We push it. It increases the hemoglobin 2 to 3 days, and then by 1 milligram. And then we actually add on or start the therapy. And we also, in case of low iron here, we give injectant ions also. But in case of nephropathy patients, we basically prefer erythropoietin because that is where the whole problem lies. Erythropoietin is not produced because of the failing kidney and because of anemia. So erythropoietin directly induces the bone marrow cells to produce hemoglobin and red blood cells. So we use erythropoietin in those cases as well as in cancer patients. I think these are the two places where we use erythropoietin injections. Now, other thing is during dialysis for nephropathy people also, we can supplement by iron injections or by giving blood transfusion at that particular place because then we can manage the volume simultaneously. That is for the continuous, not the, that's for the continuous dialysis part actually. Now, next thing is that we have to be very careful when we correct hemoglobin also because overdoing of it also leads to something which is called as polycythemia. Polycythemia in turn gives again a false reading. So what happens in anemia reverses in polycythemia. So there are too many RBCs running around. So we see a decreased HbA1c when it should be high. So we undercorrect. So that is also, that comes in a very rare case. It's not very frequently seen actually. Either you are overcorrected or there are certain diseases like polycythemia vera in which we see that, in which venesection and giving certain medicines to decrease the bone marrow is what we basically do. So that is basically about the hemoglobin and the diabetes part. Now, anything else you want to ask specifically, you can ask, but also remember there's only one type of diabetes in which increased hemoglobin is seen, that is type 1. People who have type 1 basically have a hypoxic method, that means low saturation of oxygen, because whatever blood cells are found are not actually perfect, they are deformed. So there is a hypoxia, which in turn stimulates the bone marrow, produces even more RBCs, causing an increased RBC. So when we see increased RBC with on the background of diabetes, we also check whether they are type 1 actually, because type 1 shows this increased hemoglobin. So this is basically in general. So anything else you wanted to ask?
Absolutely, ma'am. Thanks so much. I think it was very insightful and you have covered up mostly all the questions. But
Hmm.
one thing, ma'am, I want to ask you, like, generally when the iron levels are less, does it delay the healing process also in a diabetic individual?
I didn't get you.
And whenever the iron levels are less,
Hmm.
does it impact the healing of the wound in a diabetic individual?
Yeah, it does because see, any wound healing needs a increased vascularity, increased blood flow. One is if it is a diabetic wound, then already the blood cells are destroyed because obvious gangrene and other things. On
Yeah.
the top of it, if there is increased blood flow, the WBCs and lymphocytes, neutrophils, which has to go there to produce the clots and other things, and also to produce the fibrin, which is then starts cover the wounds and then it starts healing. So, and all there are several growth factors and other things which are in the blood, which all contribute to actually closing the wound. They will not reach the place, and there will be less amount of things which will be reaching the place. The factors won't reach actually. So in those cases, delay the as such diabetic wound is always a very difficult wound to treat. It will even worsen when there is a anemia.
Ma'am, please go a bit slow now on that because people are not able to hear at the times to you. So, ma'am, there is one more question by Dr. Kamlesh that
Hmm.
if hemoglobin is normal and what is
Hmm.
this normal range for you, then still person has to take the iron tablets daily, or we can, combat the levels through the natural food.
For actually, there is two. For females, it's different. For males, it's different. For females, it is basically around 12 to 15. For males, it's actually from 15 to 18. But in Indian scenario, it is kept at a little less. Around 11 is said to be okay, actually. And for males, basically, we require 12 in Indian males. For females, we have already seen that they are at the lower level. So we say okay to 10. But in those cases, we supplement with iron. If it is about 12 in an Indian female, we do not need to give iron supplementation because overdosing of iron can lead to deposition in the liver, can lead to something called hemochromatosis and cirrhosis in people who are actually sensitive, not sensitive, they may actually have the tendency to form it. We cannot know it. These are all basically a small genetic difference, but that's when we see that it is actually being deposited in the liver, which can actually damage the liver in turn, which will cause again lowering of hemoglobin actually.
So ma'am, even like Mohammed Yasin has one question that
Mm.
she feels, I don't know he or she, but feels tired after eating. What is the reason that they feel tired after eating, immediately after eating the food?
If she is feeling tired after eating, we have to check how much is her sugar level. See, if it was low in the beginning, when she eats, there is a reactive hyperglycemia, which feels almost the same tiredness as a diabetic person feels when she is not taking medicines. This is a reactive hyperglycemia, which is accentuated in case of a diabetic. It actually occurs normally, but the effect is much, much more in a diabetic. So he feels very tired immediately after meal, which actually settles down in 1.5 hours with the sugar, other molecules like insulin, everything takes care of what is there in the blood.
Absolutely. So, ma'am, in some cases, like, people who are on the BP medications, taking hypertension medications, they have
Mm,
the, lower hemoglobin levels.
mm.
So, how we can increase it and what, steps doctor take in such cases to make sure that the hemoglobin levels does not drop?
No. Basically, if you see that hypertensive medicines are decreasing the hemoglobin, we basically see can we change the medication first. See, lisinopril is that group of medications are given in certain stages. We have to weigh the risk and the balance and try to see if we can change the medications to some, or else actually supplement with iron or iron related products and diet, depending on how much the hemoglobin is lower. Very low, then definitely iron supplementation and other things will be there. Also keep a watch on the kidney. Most of these people may be having an underlying kidney problem, which is pushing up the hemoglobin. So it is a whole range of things which we have to consider when we see a hemoglobin person with a BP, with a diabetes. We have to see nephropathy, we have to rule out, we have to rule out hypertensive nephropathy also. We have to rule out if there is nephrotic symptoms, all of them actually. And then we focus on whether we can change the medicines of it or else we have to supplement.
Absolutely, ma'am. Thank you so much, ma'am. And there are a couple of more questions. People want a clarification again on the metformin part, and please, ma'am, go slow. They are not able to catch up the
Yeah,
pace. So,
metformin basically acts by acting on the sugar levels by decreasing the by increasing the sensitivity of the insulin as well as by the uptake of it. But metformin also has a problem that it also prevents the absorption of B12 actually. And B12 is very, very essential for hemoglobin formation because it is required in the bone marrow to produce the hemoglobin. So B12 deficiency comes in metformin, which can cause anemia. Other than that, the medicine is very, very safe. So that is why we usually supplement B12 with metformin.
what is your suggestion in cases where person is thalassemia? So in that case, diabetes and as well as the person is thalassemia, how to go with the iron consumption as too much iron consumption is also not advised
No.
over there.
Basically, if the hemoglobin is less than around 9 to 10, I actually would go with diet supplementation first. Around 8 to 9, I will actually add on iron tablets once in a day in the night. And for less than that, I give iron supplementation by tablet form. But we will also think about to see the serum ferritin, serum iron, everything, iron binding capacity, and start injectables. Less than 4 definitely needs blood transfusion.
Absolutely. Ma'am, how much do you think that maintaining a good glycemic control is important for maintaining a good hemoglobin levels?
Maintaining good glycemic control is important. Actually, it's the reverse, which is more important. Maintaining a good anemia, a good hemoglobin level is important for maintaining glycemic control.
Glycemic
Because
control.
what I explained that the HbA1c contains glycosylated hemoglobin, which ties up with the RBCs, prevent absorption of oxygen, and causes anemia.
Ma'am, there are a lot of people are saying my hemoglobin is 18, 17, but still my HbA1c is not dropping. Can you throw some light and tell them that what is the reason behind?
I didn't get the first part.
And many people are saying their hemoglobin levels are 16 to 18, but still there is no drop being observed in the HbA1c levels.
No, that has to be related to the sugar levels, not to the hemoglobin. The hemoglobin is okay, but to focus on something else, which is the hemoglobin levels. Why it is not happening is maybe sensitivity of the insulin being produced, not enough insulin being produced. Is there any underlying problems? Even a GRD infection, GERD infections, H. pylori infection preventing absorption, or if there is something else called the nephropathy, or which is causing actually more increase in sugar. So then in those cases, it's not anemia or the hemoglobin which is driving the HbA1c. It has more something to related to the this also. The
Absolutely.
sugar.
And I just want to
Unless
add
it's
one
a type
point.
1 diabetes. In those cases,
Ma'am, ma'am, you are on mute.
hello?
Yeah, I can hear you now.
Yeah. Tell me.
So I just
Anything
want to
else?
add one more thing over here that, even if we are taking care of, like ma'am has highlighted a lot of important factors, H. pylori can be one of the issue, and there will be many other, like, problems like GERD, which can be one of the, restrictive factor to drop your HbA1c. But one of the most, important factor which people I have seen they neglect is the food. They don't control the food, they don't follow the diet, and they expect the HbA1c to drop, on its own. So
It
there is
doesn't
no
happen,
magic
and then we
happening.
will have to go on increasing the medicines. Diet and exercise are very important, specifically in sugar.
Absolutely.
Okay.
Thank you
Yeah.
so much, ma'am, for joining us.
Yeah.
It was wonderful
Yeah.
interacting with you. Thank you, ma'am.
Thank you
Thank
so
you.
much, Dr. Jyoti. Thank you so much for joining us today.
Yeah. Thanks a lot.
Thank you.
Thank you.
I will be dropping off. Thanks.
Sure, ma'am. Thank you. So that was Dr. Jyoti. I hope you all enjoyed, and lot of information she has given us. I will share the recording of the session so that you can listen to it carefully, in the free time, because there were many important pointers being discussed. But then it's sometimes overwhelming when we listen online, right? तो बाद में आराम से बैठ के फिर से एक बार सुनिएगा क्या क्या पॉइंटर्स, बट मैं एक बार जस्ट कर देती हूँ आपको. बहुत इंपॉर्टेंट है कि हीमोग्लोबिन पे हम बहुत फोकस करें सो दैट आर HbA1c ड्रॉप्स प्रॉपर्ली ऑन टाइम. मेकिंग श्योर अगर आपके पास मेटफॉर्मिन खा रहे हैं, कोई भी बीपी के मेडिकेशन पे हैं, वहां आयरन लेवल्स ऑटोमेटिकली ड्रॉप होता है, उधर भी ध्यान रखना बहुत जरूरी है. तो प्लीज मेक श्योर आयरन लेवल्स आर ऑलवेज एट इट्स ऑप्टिमम लेवल. वी कैन आउटसोर्स इट थ्रू द डाइट. We have to exercise so that the liver can produce the hemoglobin and help you in recombating the normal range. Now, apart from that, I will give it to Vedika, because now the sources, what are the sources which we should incorporate in the diet? So Vedika is going to take up, but लेकिन एक मैं important source सबको बताती हूँ जो बंगाल में है. कूले खाड़ा is one of the very good leaf extract that you get there. कूले खाड़ा की एक ट्री होती है, वो आप लीजिए. That is very good to increase the blood sugar, your blood hemoglobin levels. And Bangalore, North, सब जो सहजन के पत्ते, moringa leaves is one of the important. Now, rest of the ingredients जो कि हम daily अपने diet के through ले सकते हैं, Vedika is going to highlight, so I'm going to give it to her.
Okay, one question which I got a lot that some of them said that my hemoglobin is good, but my HbA1c is not dropping. You need to do a lot of control in your diet and workout. Trust me, without that, it is next to impossible. I've seen people, Vedika, I will not eat chapati at all. I will not eat rice at all, right? But I'm not okay with the workout. Will it be helpful? No. Sorry. You have to make sure, you have to make it a routine that you are doing your workout. I'm not a diabetic, Nay is not a diabetic person, patient, but why we are doing workouts? Right? You could simply sit, here and take a, do our office and then sleep and then eat, sleep, routine we can do. But we don't want to be into that, lifestyle disorders. So we make sure that we are taking some, extra precautions like doing workout daily. As we said, we do muscles training. That is very important. So just see to it. Are you taking care of your diet? Right? Are you following meal sequencing, menace in meal sequencing? Are you taking your fiber, protein, and then carbs? Or you are also someone, I got one client, he said, Vidika, 6 chapati se pehle pet nahi bharta hai. I want to have 6 chapatis. And if you'll see the other, the protein intake, it's hardly 3-4 grams in a particular meal. Do you think this is the proper, plating method, or this is the proper division of the, the nutrition which we need? No. So if you want to, increase Iron-rich food, as Neha said, moringa is amazing. And one for instance, the moment our Prime Minister said, Narendra Modi, that, I ate moringa, all of my clients came to bombarding me that, Vedika, what is moringa? How we can have it? So, drumstick, as we said in North, we have the plants available from drumstick. Please start using in your chutneys, in your, curry, like we use curry leaves or pudina or dhania, like same way you can use it, right? Iron-rich food, all your green leafy vegetables, all. These days in North, I can see, there's spinach. I hope I'll say in Hindi if people want. Um, the palak aata hai, batua, methi. Make sure your fridge is full of that. If you don't like it in a sabji form, mix in your, your flour and then make chapati out of that, please. Right? All your lentils, chickpeas, your beans, right? When your kidney miss your rajma, everything comes to that, and seeds. We always miss on this part. People munch a lot of namkeens. Have you ever tried to make your own namkeen? How you can make it? Add a good amount of almonds, walnuts, and a packet of 7 mixed seeds, right? Mix them together, and maybe for taste, you can sprinkle, rock salt to that, and then start having that in place of your namkeen. You will see a lot of difference in your, in your parameters, especially people who are struggling with their BP, people who are struggling with their, your hemoglobin levels, right? You will see a lot of difference. Second, vegetables. Very easy. Guys, make sure for 2 days you're chopping your vegetables. If you're not getting time, whatever you're making, just have a handful of vegetable and add to that. For an example, what I do, I make sure that one day, one meal I'm having soup. Do not go for no tomato soup or things like that. Please, those are packed and preserved. The water, the salt intake is really on the higher side. It might shoot up your BP, right? Because of the sodium intake. Make sure that you're having, homemade soups. So all your green leafy vegetable, your bell peppers, right? Your broccoli, mushrooms, right? Try to infuse as much as you can. And I think these are very easy. The person who came in my society, he bring that daily. So don't say Vedika, these are really hard. Palak, bathua, methi itna sasta kuch nahi aata is time pe. So these are very pocket friendly. Try to include that as much as you can. And for the days you're not available, these just go for, seeds. We have a lot of pumpkin seeds, sesame seeds. Try to include a lot of flex seeds in your diet. Best source of soluble fiber, right? So try to include a lot of flex seeds in your diet. Now, vitamin B12 and folate plays an important role in nerve functions. I will give you a classic example. One of my client is complaining that he is having some, a breathing issue in the morning, right? Breathing and uneasiness. He's falling. People who are saying now that right after meal they are falling asleep. Have you ever checked your B12? Just try to, check your B12. It will be on the lower side. That's why right after having your meal, you are having a lot of discomfort and you're feeling a lot of sleep, you're feeling sleepy after that, right? So make sure that you are including, vitamin B12 and folate. These days, people who think they are very low in vitamin B12, we have these shots every week at a time span of 4 week. Doctor do suggest that. And I have seen, I've done the study, the moment we give that vitamin B12 and folate to my client, his energy levels, his sleeping issue right after the meal is sorted, right? So vitamin B12 also help you in the red blood cell formation. And as I said, he's having a lot of, congestion. He's feeling a lot of, pain in the chest. So it's not, please do not relate it always like I might be having a heart attack. No. Check with this small thing as well, right? Take the baby step. See how the amount of vitamin D, vitamin B12. Why we always say keep an eye on your vitamin D12 and B. A lot of absorption get hindered if you're not taking care of these macronutrients. Not just protein, fiber, and fats are important. Vitamin B12, iron, vitamin D plays an equally important role in that. So make sure that you are including, these for the non-veg, you can easily go for chicken, fish, amazing source, right? Though I'm a pure vegetarian, but I keep saying, so chicken, we do avoid chicken for the people who have very high, lipid profile. So we try to restrict in that part, but fish can be taken in that case, right? Go for fish, amazing source. Now people come, Vedika, can we go for a fried fish? Please ask yourself first, right? When you're asking for fried fish, right? We have a lot of recipes, and Neha, if I'm not wrong, we have a lot of recipes in the Sugarfit app as well under the recipe section.
Yes.
A lot of people don't explore the app, right? So when you ask for the recipes, even I cook from the Sugarfit app. We have amazing sattu recipe to increase the protein intake. People who are vegetarian like me can easily go for that, right? For B12, we have a lot of things. As I said, include a lot of seeds in your diet. Rather than taking multivitamin tablets, add moringa and mixed seeds. You are good to go. The natural sources of your macronutrients.
Absolutely. So I think we are done for the day, but keep all these ingredients in mind. But tell me and promise me one thing today. You are going to focus on your iron intake and your protein intake from now onwards. Can I get a raise your hands? Yes, I will. Add the protein and the iron in everyday basis. Like, on everyday basis, you have to incorporate it. And proteins I want in everyday meal. Vegetarian sources. What are the protein sources? Paneer is there, soya bean is there, sare pulses, dal, all are rich in proteins. Legumes, chole, rajma, lobia, ये सब proteins हैं. Then, if we talk about the non-vegetarian sources, fish like salmon, mackerel, these are very good. Sardines is also very good in protein sources. Eggs, if you are taking very regularly, please take the egg whites instead of taking the egg yellow. 6 एग खा सकते हैं पूरे हफ्ते में अगर पूरे होल एग्स ले रहे हैं और देसी एग्स लीजिए इंस्टेड ऑफ टेकिंग द व्हाइट एग्स में क्या है देयर इज अ IG3 कंटेंट व्हिच इज लाइक we inject the hormonal injection to the chickens to keep on producing the eggs throughout the year, and that's why it's so easily available very freely, and at very reasonable rates. But the poultry eggs, which is little yellowish in color, they are more healthy, more secured, and safe for us. Okay? Red meat, please avoid. It is very high in bad fats, increases your cholesterol, increases the inflammation. Once in a month or once in 6 months, it's okay. Please don't take it very frequently. And what are the 2 things which I said we have to do? Iron-rich food and the proteins. Don't miss that. If you want to reverse your diabetes and within the 3 months, see the drop, it will be better than what it used to be earlier.
I promised Neha from you is to bring my hemoglobin from 12 to 15. As you said, I'll make sure that, I'm increasing my hemoglobin, not just 12. 12 is the basic, which we need. This is the basic requirement. Make sure you're trying for more than, 14, even from females, right? And males, as you know now, it is equally important for you also, right? So make sure you're maintaining a good levels.
Are we all ready to increase our hemoglobin levels? Are we going to focus? Yes. Enjoyed the session. It was a good learning. बहुत सारे लोग आगे कहते हैं अरे कोचेस तो हमें बता ही रहे हैं डॉक्टर्स ही बता रहे हैं बट वो 15 मिनट्स में क्या क्या बताएंगे है ना टू अंडरस्टैंड इन डिटेल टू understand each and every concept well, half information is always less. Always get the complete information.
And harmful as well.
Exactly, Vedika. And I want all of you to join my health series on the fitness 6 से लेके 11 तक 7:30 to 8:30 मुझे दे दीजिए please. It's a humble request. 6 to 11 a.m. to 8:30 a.m. Please give it to me wherever you are, whatever you are doing. Listen to the series. It's very important health series. We have called the celebrity fitness trainers to help us in understanding the minuteness of these workouts, how to take care of the nutrition, how to take care of your health, and make the workouts much more productive. And who all can do the workout and how they can do it. It is planned keeping all the old age people even in mind. So please do join us, and I want to see you all over there. 7:30 to 8:30. Sab karenge join?
And that will be a learning for you. The people who are saying we are following everything but not seeing the results, join this series and you will see the results in your levels. And me and Neha will be for sure. Neha, that's my promise. I'll be there. I'm into workouts, and people, those who find struggling how to start, they don't know, join this series. That will be really helpful. How to start your workout. What is the basics, right? Join this one, please.
6:30 a.m. 7:30 to 8:30 a.m. in the morning. The session is from 7:30 to 8:30 a.m. in the morning from 6 till 11. I will share the link in the premium group. और एक चीज और प्रॉमिस करनी है, जो भी आप खा रहे हैं ना प्रीमियम ग्रुप में, you have to put all the pictures. I will help you in analyzing it and making it much more nourishing. Okay, along with your coaches. So please do add it. It's a journey, fitness journey, a journey towards the wellness, which we all have to, spend together. So enjoy this journey. Spend each and every minute in a healthier future. We don't want to be dependent on anyone. Do we want to be dependent on anyone? सारी जिंदगी खुद की है, आगे भी खुद से करेंगे, right? So stay strong, stay fit, stay healthy, and keep moving. See you in the health series on 6th of February, 7:30 a.m. सुबह 7:30 बजे. Bye bye. Take care. Thank you for joining. Happy Sunday. Thank you, Vedika. Thank you so much.
We'll wait for the meal pictures, as Neha rightly said. I need a lot of meal pictures in the group, and give us idea. Now, we're not saying that meal pictures will be wrong. No, you might be more interesting than ours. So even we need ideas, right? So please keep sharing your meal pictures in the group. That helps us and other people as well. So reverse your diabetes and help others as well, please, to sharing a lot of ideas in the group.
जो वर्किंग वुमेन है, वर्किंग मैन है, आई वांट एवरीवन टू प्लग इन द हेडफोन्स एंड जाते जाते सुन लो, काम करते करते वेबिनार सुन लो. बस व्हाट इज इंपॉर्टेंट टू अंडरस्टैंड द टेक्निकलिटीज. रिकॉर्डिंग उन्हीं को मिलेगा जो रोज ज्वाइन करेंगे. आई एम नॉट गोइंग टू गिव रिकॉर्डिंग टू एनीवन अनटिल एंड अनलेस यू ज्वाइन, बिकॉज वो जो सीखने का मजा लाइव है ना, वो रिकॉर्डिंग में नहीं है. टुकड़ों में सुनते हैं, उसका कुछ सीखने को भी नहीं मिलता हमें. So please do join. It's a humble request to each one of you. Take care. Have a wonderful Sunday.